We have a second lab that we built, a brand new lab that we built just for COVID testing. And we're actually going to take you inside that lab and meet our director, Lisa Gorlick.
We're standing in the largest COVID-19 testing laboratory in Nevada. I'm very proud of the fact that Nevada, as a result of this laboratory, is one of the states that is not just testing symptomatic individuals. We're actually testing asymptomatic individuals, along with obviously symptomatic individuals. This area was originally a physical therapy rehab department, and within 3 weeks, with the help of a lot of people, it was transformed into the laboratory that we're in today. We started ramping up from 100 tests a day that met UMC's needs. And we've been ramping up gradually. We went to about 500 tests a day and then 1,000 tests a day. The beginning of May, we went to 5,000 tests a day. And then the beginning of June, we went to 10,000 tests a day. So it's changed dramatically. We're testing every patient that's admitted into the hospital. And we're proud that we're able to produce those results in a very quick turnaround time. So if you are admitted to the hospital or you are suspected, you're at the hospital and suspected of having or potentially having COVID-19, you are tested on with that time frame in mind. It makes UMC a much, much safer place for everybody, the employees. I mean, identifying who's positive makes all the difference in the world, because we can then make sure that we're handling everybody in the proper way. Even our outpatient surgeries are tested for COVID-19 before they come into the hospital. So this makes UMC a much safer place to be a patient and to be an employee. If you are registered for a COVID-19 PCR test at one of our drive-through testing locations, you're already registered in our computer system for the hospital. And whenever your specimen arrives in the laboratory, it already has a barcode and a label on it. So we can bring those into the laboratory very quickly. It's run through the testing process. It's resulted in the computer system that's interfaced with the hospital computer system, and the patient can get real-time results through the UMC Connect portal. And literally, when we result the test in the laboratory, it moves directly to that portal and makes it available for the patients to see. PCR test indicates that the patient is positive and is shedding the virus. The antibody test indicates past exposure or previous exposure of some kind. And if you develop antibodies to the test, then we know that at one point that you had the virus and might have been asymptomatic. And a lot of people are very interested in that because they believe they may have had it at one point, but didn't really have a lot of symptoms. And so this is an opportunity, if they had the antibody test, to determine whether they have had previous exposure. If you can identify the individuals who are positive, then you can take special precautions with that group. In addition to that, the epidemiology piece of this is very important. Where that person has been, who they've been in contact with, have they been to see their elderly grandmother, have they been, playing with their grandchildren, and how those individuals have interacted with other people. So it allows a positive person through the epidemiology process to find out exactly who they've been in contact with, who might be positive as well. And that really helps us determine and slow the spread of the virus. UMC is Las Vegas. And that's really what it says, because nobody has stepped up to the level that we have and pulled out all the stops in order to make something like this happen. And I think that makes UMC, Las Vegas.